very good day to you and warm welcome to Health Talk, your weekly dose of analysis of current health issues. We broadcast live from Johannesburg in South Africa. You can also find Health Talk on our YouTube channel. I'm Dr. Selom Daoud. Coming up on today's show is a discussion on dietary or nutritional supplements. We have two special guests, a nutritional therapist and exercise physiologist, accompanied by another clinical nutritional therapist to help us understand all that is important about supplements. If you've always wanted to know whether or not you should be popping those multivitamin pills on a daily basis, whether or not supplements can help improve your athletic performance, then this is the show for you. At the end of the show, you hopefully should be empowered enough to be able to make an informed decision on whether or not and under what circumstances you should take dietary supplements. You also have the opportunity to pose any question relating to supplements to our expert guests or to simply share your experience by dialing us on Johannesburg 714-6843, 6847 or 6857. But before our main topic for today, we look at current health stories making headlines. The 2014 Ebola epidemic is the largest in history, affecting multiple countries in West Africa. According to the CDC, or Center for Disease Control, the total death count to date is 3,330, with 3,953 confirmed laboratory cases. The figures recorded may not reflect the correct number of cases, as there's a strong possibility that there are still more unidentified infected cases amongst communities. Please take a look.
According to the World Health Organization, the spread and cruelty of the West African Ebola epidemic is purely due to poor infrastructure and the lack of basic health care services. The hospitals in the region simply are not equipped to deal with the disease at the rate that it's spreading. The nurses, some infected and grossly underpaid, had stopped showing up to work out of fear, frustration, or because they have fallen sick themselves. Concerns are still high in West Africa, especially Guinea, Liberia, and Sierra Leone, that are most affected by the outbreak. The WHO says more than 3,000 people have died from the virus since March. Without additional intervention or changes in community behavior, CDC estimates that by January the 20th, 2015, there will be a total of approximately 1.4 million Ebola cases. Cases in Liberia are currently doubling every 15 to 20 days, and those in Sierra Leone and Guinea are doubling every 30 to 40 days. Aid organizations that are on the ground are in desperate need of assistance to stop this growing epidemic. They are mainly providing healthcare services, educational programs, and delivering medical supplies. If conditions remain unchanged, the situation will rapidly become much worse. The cost of delay will be devastating. The number of cases is doubling every 20 days.
Now, many people will remember Zaki Ahmad's activism on access to treatment for HIV-infected people. He co-founded the Treatment Action Campaign, an organization that came to be known worldwide for its AIDS activism. After almost 2 decades spent fighting for HIV treatment and access to medicines, the TAC may close its doors due to a severe funding shortage. Take a look at this insert produced by Thembi Majombozi.
Our job is to make sure that no one profiteers from our misery.
Founded in 1998, the Treatment Action Campaign was started to advocate for increased access to treatment, for the provision of care and support, services to people living with HIV, the reduction of HIV infections, and to ensure that people live healthy lifestyles. TAC programs reach poor communities in rural, remote, and urban areas, an indication that they are a community-based organization. With 267 branches and 72 full-time employees nationwide, they made their mark in the country through activism and grassroots support. The New York Times named the TAC as the most effective AIDS group in Africa. They have received international accolades for their activism. TAC's activism has resulted in life-saving interventions such as the implementation of mother-to-child transmission prevention as well as their antiretroviral treatment programs. Despite all their good work, TAC is experiencing financial challenges that, if not addressed by February 2015, will lead to its closure. At a time when the HIV incidence in South Africa is escalating among young people. As the TAC funding shrinks, so may healthcare service delivery to the public, a threat to the Bill of Rights and the Constitution in South Africa.
For a discussion on the TAC, we're joined in our Cape Town studio by Nosipho Kota, who's the TAC Communications Coordinator. Nosipho, welcome to